There are lots of disease out there. Some of them can be treated, um, but we don't do much, or we don't talk about it much, or we don't create awareness. So most people think they can't do anything about certain type of disease, especially the one that come with a deformity. Okay, and I came across this particular deformity, clubfoot. Okay, you see, when a baby is born, you see that some of them, their leg is twisted. It's not like it doesn't form well. Okay, uh, you can check on the screen what I'm talking about. It doesn't form well, and mostly things like that, parents think it can be like treated. So out of criticization, then other things, they hide the children, and when they grow, they live like that with those kind of, food that is twisted. But there is good news. Most of the reason when you treat them at the early stage, it's possible that you can reverse them back to normal, especially the club food I'm talking about. If you're having a child, or if you give birth to a child that is having that kind of food, the probability of the child food coming back to normal is very high, because the child is still developing and it can be corrected. Okay, they recently launched some campaign on club food, and they are treating some, children that are, having that condition, like in Kumasi area. Okay. And what I want to really talk about is, it's not anything that parents should hide. Okay, stigmatize. I know there's a stigmatization that attached to that club foot. Okay, having your child having that twisted leg, it doesn't form like the way normal child leg form. You feel some way, and if you are not careful, you may hide your child from the public for a long. And when you are doing that, you are hurting your child, because instead of you to bring the child or send your child to the hospital at the early stage, you will wait till when the child grow before, and when the child develop, it can be corrected. Okay, okay, good. And we have some factors. Okay, we have some factors that can, lead to this club foot formation. Factors like genetics. Okay, you see, when the baby is in the womb, and the formation, the formation have started, the head, the leg, and other part of the body, sometimes there can be miscommunication between the genes. Okay, it can be miscommunication. Okay? And as other parts of the bodies are forming, when it gets to the leg, the communication doesn't go on between the genes, so it can result to a child being born like that. Okay, so if it's being born like that, and the doctors attend to that child early, there are a lot of methods that they can use to reverse that club foot. Okay. Other stuff is, when you are a pregnant woman and you smoke or use some medication that have not been prescribed by your midwife or your gynecologist. Okay, when you abuse some medication, or you are staying in an environment that they smoke a lot. If you yourself you don't smoke, but you are staying in an environment that they smoke a lot, if you are pregnant and you may give birth to a child, having a twisted leg like that, called the clubfoot. Okay. So if you are pregnant, you should be very careful of things that you do. You must follow every rule that will be given to you by your midwife or your gynecologist, to prevent some things like this, these deformities like this. And now, it's possible, like a lot of solutions are there to reverse that condition back. So parents shouldn't hide their children. Okay, we shouldn't hide our children. If you find out that your child is having that twisted leg, okay, that is called the club foot, you should bring them, to send them to any hospital. The doctors, they know what to do, and they can reverse it back to normal. Okay, don't let the child grow, or don't hide the child from the public to the extent that when they grow before they be, because as soon as they grow and they pass some ages, they can reverse it back. So as soon as the baby is born, within some 6 months time, they must what, correct that deformity. Okay, they must correct it.